My parents got COVID this year, 2024. It's the Omicron GN1 or something like this. We are in Canada, and the Canadian government does offer, or at least the Quebec province does offer for free this medication. The intent of this medication is once an old person gets COVID, and that person is a risk, has other issues, health issues, this medication would be to be taken during the first days of symptoms. So once you get the symptoms, within 5 days, the person must start the medication Paxlovid, and this medication is expected to reduce the symptoms and to reduce the risk of aggravation and being hospitalized. Basically, the government calculation is that if an old person at risk will take this medication, there are, I believe, from statistics, 80 to 90% chances that that person will not need medical care inside the hospital, we just stay at home. So this is how it helps. It does not reduce completely the symptoms of COVID. Both parents are around 80 years old. One has diabetes, the other one had heart surgery, also some medication for cancer treatment, not very advanced. Now, this medication does have a lot of restrictions. I'm going to post them in the comment section. It's not my page, it's an official page with restrictions. So for those persons taking a lot of medications other than this one, there is a lot of interactions. So the way we did got this actually is we did contact directly the pharmacist. So the parents had a file at one pharmacist, actually was at Costco. We did contact the pharmacist. The pharmacist did check their the file with all their medication, other medication, did check their kidney function also. It's important to check that. And then he did prescribe this for them. Actually, one of them, I think the pharmacist did say not to take all the pills. This is what it looks inside. There are like several of these. One of the parents was instructed not to stop some other medication and not to take all of the pills. So there is a lot of interaction. That's actually the pharmacist that will tell you what you should take or not, or if you can take this medication. They did not went through the family practitioner, directly to the pharmacist, and it's free. However, I had to call several pharmacies, several drugstores. Many of them did not have this medication. Others were very not clear about being able to prescribe, do a prescription. So you need to really shop around. It's not in every place. And I think pharmacists also are afraid to prescribe this, to give this to all persons, because like I said, they need to take the pharmacists need to take responsibility, because there is a lot of interactions, and I think many pharmacists don't want to take that responsibility to check the file properly, the other medications of the person. So they may be becoming very vague, these pharmacists, which of course it's illegal, but there's nothing to stop them in Canada. It's a very that's how it works in Canada. All I want to say is that you have the right for this if you are an old person, and it's also free, but there are going to be obstacles because the pharmacists are not honest. Okay, so this is the medication. Now, if you, I don't know, it's important here. This is what it's included. And there's actually two types of pills, it looks, and one is need whatever name. This is the second one. Sorry, the camera is not very clear. And again, you take this. Looks like there are five of these. What do we call them? Each with 6 pills day night. So you take this for 5 days. The faster you start, so the sooner you start after the first symptom, the better it is. The outcome for my parents is hard to tell. They didn't went to hospital. It was pretty miserable for them for about 2 weeks. Even with this treatment, it's really difficult to compare because if I was to tell you it did help a lot, I will have to compare for the same person with and without the medication. So I don't know. I'm going to guess it did help for younger persons with medical problems. Just call your pharmacist. Call, I think, also 811, if I believe. That's like a phone for sort of medical help or by the phone from the government. I think it's 811 in Quebec. So just inform yourself if you have access to this medication, depending on your age, condition. Otherwise, I don't know if you can purchase it separately with money for yourself. I do not know that information. Okay, thanks for watching.